Hello, my name is Lucy Kasorek, licensed insurance broker. Presenting with me is Nicole Wall, licensed insurance broker and owner of Holton Insurance. The Medicare Scholar Program is designed to give educational content about different Medicare topics throughout the year. Today we will be going over Medicare 101. So what we're going to be covering today: who is eligible for Medicare? What are your coverage options? Where can you enroll? What are the next steps? And what type of questions would you have? So first, who's eligible for Medicare? Well, you must be a U.S. citizen or a legal resident for at least 5 consecutive years and one of the following: age 65 or older, under 65 with a qualifying disability, or any person diagnosed with end-stage renal disease or ALS, Lou Gehrig's disease. Your coverage options: Part A, Part B, Part C, Part D, and MedSup, or Medicare Supplement. Original Medicare is comprised of Part A plus Part B. Part A under Original Medicare is hospital insurance. It's inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. The costs: it's premium free if you've worked 40 quarters. There is a $1,556 deductible for 2022. The coverage: stays of more than 60 days have daily copays. You can utilize any hospital that accepts Medicare, and hospital coverage outside of the United States usually is not covered. Part B, doctors and outpatient visits, covers physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment such as wheelchairs, oxygen, etc., outpatient physical, occupational, and speech-language therapy, and some preventative care. Costs: you pay 20% of Medicare-approved costs. The monthly premium is adjusted based on your income and may be higher if you sign up after your initial enrollment period. Coverage: physicians who accept Medicare, and some preventative health care is provided. So Part A and B, what's not covered? Part A and B deductibles, coinsurance, and premiums. Part B excess charges, outpatient prescription drugs, additional benefits such as hearing, vision, and most dental, long-term care or custodial care. Part D, prescription drug plans. Prescription drug plans. It helps with the cost of prescription drugs. They're only offered through private insurance companies. You must continue to pay your Part B premiums. For medications you receive from a retail or mail order pharmacy. Costs: coverage varies from plan to plan. Catastrophic coverage protects you from high drug costs. Benefits can change year to year. Enrollment: coverage is not automatic. Penalties may apply if you enroll late. Coverage: each plan has a list of drugs it covers called a formulary. List of drugs can change throughout the year. Part D formulary. A formulary is the list of drugs covered by a Part D plan. All plans have a tiered formulary. Generally, the lower the tier, the lower the out-of-pocket cost. Coverage stages. There are 4 different coverage stages: annual deductible, initial coverage, coverage gap or the donut hole, and catastrophic coverage. The coverage cycle starts over on January 1st of each year. Cost sharing for Part D for 2022. The annual deductible is up to $480. Initial coverage limit is $4,430. Coverage gap or donut hole, you pay 25% for covered drugs. Catastrophic coverage, $7,050 and above. Drug copays are reduced to generics are $3.95 or 5%, whichever is greater. Brand name drugs, $9.58 or 5%, whichever is greater.
Medicare Advantage plans. They are Part A plus Part B plus your Part D, and they wrap that all together and they call that Part C. Medicare Advantage plans combines both Medicare Part A and Part B, may also include prescription drug coverage. It is offered by private insurance companies and often include additional benefits above and beyond original Medicare. This varies by plan. Eligibility for Part C. Must be enrolled in Medicare Part A and Medicare Part B, must live in the planned service area, which is county-based, and must be able to make an informed decision. The costs. Plan premiums and benefits can change year to year. Must continue to pay your Part B premium. Coverage. Many plans include prescription drug coverage or your Part D. Coverage can be limited to a service area unless it's an emergency. You may be required to use a network of doctors and hospitals, and may include additional benefits above original Medicare, which also varies by plan. Types of Part C plans. Coordinated care plans. These include Health Maintenance Organization, or HMO, Health Maintenance Organization Point of Service, HMO POS, Preferred Provider Organization, or PPO, and Special Needs Plans, also known as SNPs. Other plans include Private Fee-for-Service, or PFS, and Medicare Savings Accounts, MSA, and Medicare Cost Plans. Medicare Supplement Insurance. Medicare Supplement Insurance helps cover gaps in original Medicare. They are sold by private insurance companies. Plans are named A, B, C, D, F, G, K, L, M, N, also known as the alphabet soup plans. High deductible Plan F and high deductible Plan G. Massachusetts and Minnesota and Wisconsin have different standardized plans. Benefits can vary by plan and when your Medicare coverage began. To be eligible, you must be enrolled in Medicare Part A and Part B. You must be a resident of the state in which you are applying for coverage, and you must be age 65 or over or under 65 in certain states. The costs. It helps with some of the out-of-pocket costs not paid by original Medicare. Premiums may vary based on age, sex, tobacco, status, zip code, plan, and carrier. Enrollment. Generally, the best time to enroll is during the 6-month open enrollment period following your 65th birthday month or Part B effective date if later. There may be other situations in which your acceptance may be guaranteed. Plan choices. You have 2 different options after you enroll in Original Medicare, which is provided by the government and consists of Part A, which covers hospital stays, and Part B, which covers doctor and outpatient visits. Option 1 is Medicare Supplement Insurance offered by private companies, covers some of the costs not paid by Original Medicare Parts A and B, and you have the option to add Medicare Part D offered by private companies. Part D covers prescription drugs. Or option 2, you can choose a Medicare Advantage plan. Medicare Advantage plan is also offered by private companies. It consists of Part C, which combines Part A, hospital, and Part B, doctor. Also provides additional benefits and may include Part D, which covers prescription drugs. When can I enroll? You can enroll during the Medicare initial enrollment period. This is the month you turn 65 years old. You can also enroll 3 months before and 3 months after. What if you work past age 65? If you are working past age 65, you may enroll in Parts A and Part B. However, it's recommended that you speak with your benefits administrator. Also, keep records of your health insurance coverage. Enrollment after age 65, like when you are retiring, you may be eligible for a special enrollment period that may allow you to enroll in Original Medicare for up to 8 months after the loss of employment or employer coverage, whichever happens first. May also enroll in a Medicare Advantage or prescription drug plan for up to 2 full months after loss of employer health benefits. New to Medicare, working beyond 65. If your employer has fewer than 20 employees, you have 3 months before, the month of, and 3 months after your 65th birthday month. Medicare Supplement Open Enrollment. This period lasts for 6 months and begins on the first day of the month in which you're both 65 or older and enrolled in Medicare Part B. Additional elections. Annual enrollment period, which runs October 15th through December 7th. Plans begin January 1st. Open enrollment period, which is January 1st through March 31st. May change from one Medicare Advantage to another or back to Original Medicare with or without Part D coverage. Special enrollment periods, examples include moving into a new area, discontinuation of your current plan, receiving skilled nursing care, or low income/Medicaid. Next steps. You want to review your enrollment periods, research your options, ask questions and seek help, enroll, and have a yearly review. Thank you for watching. If you have any questions, please feel free to contact us. If you would like to have a free Medicare Scholar presentation at your local senior center, VFW, lodge, or other activity group, let us know and we would love to set something up with you. There's a one-page summary about this topic in PDF format you can access by clicking on the link in the description below. Lastly, keep a lookout for our next presentation.